According to the latest statistics, last year 630,000 people died of HIV-related illness, and 1.3 million people around the world got infected with the virus in 2023. The statistics provided at the news briefing also revealed that in 2023, 570 young women and girls aged between 15 and 24 became HIV positive on any given day. Since the outbreak of HIV, 42.3 million people have reportedly lost their lives to HIV/AIDS. At present, 39.9 million people are living with HIV, 65% of which are in Africa. Statistics have also pegged the number of HIV-positive people who are not receiving life-saving treatment at 9.3 million. In the Gambia, the HIV prevalent rates stands at 1.3, with Basse, Bansang and Brikama accounting for the most cases.
To protect everyone's health, we need to protect everyone's right. The path that ends AIDS is the right path. Upholding the United Nations Declaration on Human Rights and fostering inclusion of all communities are essential for ending AIDS, for ensuring sustainable development, and for human security.
The situation in the Gambia is understandably a cause for concern with the anti-HIV coalition. So too is the disproportionately high prevalent rates in Basse, Bansang and Brikama, which underscored the need for targeted intervention and awareness-raising campaigns. Campaigners are calling for the prioritization of human resource aspects and stressing the need to ensure access to treatment and scale up advocacy campaigns to combat stigma and discrimination.
In the Gambia, out of the 26,000 people living with HIV in 2023, almost 60% of them were diagnosed. That's the first 95. That's the diagnosing, identify people who have HIV. Not those who are tested, but those who are HIV positive. We should be able to identify 95% of them, but we were able to achieve 60%. Self-testing also, we are trying to see how best we can actually put that in place, whereby you can test yourself. Because stigma is one of the problems that's actually retarding our interventions. We must have to try to help to reach out to vulnerable and stigmatized and other difficult to reach populations. Help young people take leadership in the HIV response. The HIV response is at a crossroads. Whether the world ends HIV depends on the path that leaders take.
In 22 countries in West and Central Africa, girls and women aged between 15 and 24 years are said to be 3 times more likely to be living with HIV than their male peers.
Ending AIDS requires that we reach and engage everyone who is living with the virus, at risk for or affected by HIV. Human rights violations are still preventing the world from ending AIDS. When girls are denied education and information, when there is impunity for gender-based violence, when people can be arrested for who they are, when a visit to health services is dangerous for people because of the community they are from, the result is that people are blocked from being able to access HIV services that are essential to save their lives and to end the AIDS epidemic.
The task is enormous, but there is every indication that with concerted efforts and inroads being made in the areas of access to ARVS prevention and the availability of vaccines in parts of the global north, the drive to promote HIV/AIDS from the list of conditions that pose a threat to public health could be achieved by 2030. Omar Faye, GRTS.